Have you ever wondered, what exactly is a C-section? Why do some women need one? What happens during the surgery? Are there any risks? And what about those myths you've heard? Well, stick around because we're breaking it all down, step by step, in a way that's easy to understand. Whether you're an expecting mom, planning for the future, or just curious, this video is for you. What is a caesarean section? A caesarean section, or C-section, is a surgical procedure used to deliver a baby when a vaginal birth is not safe or possible. Instead of the baby coming out through the birth canal, the doctor makes a surgical incision in the mother's abdomen and uterus to deliver the baby. Why is it called a caesarean section? There are many theories, but one of the most popular is that Julius Caesar was born this way, though historians debate whether this is actually true. How common are C-sections? C-sections are one of the most common surgeries worldwide. In some countries, over 30% of births happen via C-section. But why do some women need a C-section while others give birth naturally? Let's find out. Why do some women need a C-section? A C-section isn't a choice. It's a medical decision made to protect the health of the mother and baby. There are two types: emergency C-section. These happen when something goes wrong during labor and doctors need to deliver the baby quickly. Fetal distress. If the baby's heart rate drops and they're not getting enough oxygen, an immediate C-section is needed. Prolonged labor. If labor has been going on for hours but the cervix isn't dilating properly, doctors may decide on a C-section. Umbilical cord problems. If the umbilical cord is wrapped around the baby's neck or has slipped out before the baby, it can cut off oxygen. Placental abruption. This is when the placenta detaches from the uterus too early, causing severe bleeding and oxygen loss. Uterine rupture. If the uterus tears, especially in women with a previous C-section, an immediate operation is required. Planned C-section. Doctors sometimes decide a C-section is the safest option before labor even begins. Placenta previa. The placenta is covering the cervix, blocking the baby's way out. Multiple births. If there are 2 or more babies, a C-section may be safer, especially if they aren't positioned correctly. Breech or transverse baby. If the baby is feet first or lying sideways, a vaginal birth is dangerous. Maternal health conditions. Conditions like high blood pressure, heart disease, diabetes, or infections may require a C-section. Previous C-section. While many women can have a vaginal birth after C-section, some need another C-section due to risks like uterine rupture. What happens during a C-section? Well, now that we know why a C-section might be needed, let's walk through the entire process from start to finish. First, before the surgery, the mom is taken to the operating theater. A nurse then inserts an IV into her arm for fluids and medications. A catheter is placed in her bladder, but don't worry, she won't feel it due to the anesthesia. The anesthetist gives spinal or epidural anesthesia, numbing the lower half of her body while keeping her awake. The surgical area is cleaned and covered with sterile sheets. Next, during the surgery itself, the doctor makes a small horizontal incision in the lower abdomen, just above the pubic area. They carefully cut through skin, fat, and muscle layers to reach the uterus. The uterus is then opened, and the baby is gently pulled out, usually within 5 to 10 minutes. The umbilical cord is cut, and the placenta is removed. The uterus is stitched up, and the abdominal incision is closed with stitches. After the surgery, the mom is taken to the recovery room, where she is monitored for a few hours. Pain relief is given to help with post-op discomfort. Walking is encouraged within 24 hours to prevent blood clots. The incision takes about 6 weeks to heal, though some discomfort is normal. And that's the step-by-step process of what happens during a C-section. Possible complications of a C-section. C-sections are generally safe, but as with any surgery, there are risks. Infection. The incision site or uterus can become infected. Heavy bleeding, also known as hemorrhage. Some women may lose more blood than in vaginal birth. Blood clots. Walking early helps prevent clots in the legs or lungs. Breathing issues for babies born via C-section may have more fluid in their lungs, but this usually clears up quickly. Future pregnancy risks. A previous C-section can slightly increase the risk of complications like placenta previa or uterine rupture in later pregnancies. Myths about C-sections debunked. Let's clear up some of the biggest myths. Myth 1. C-sections are the easy way out. Truth: major surgery is never easy. Recovery can be longer and more painful than vaginal birth. Myth 2. Once a C-section, always a C-section. Truth: many women can have a vaginal birth after C-section or VBAC if conditions are right. Myth 3. C-section babies are weaker. Truth: most babies born via C-section are just as strong and healthy as those born vaginally. Myth 4. You don't bond as well with a C-section baby. Truth: skin-to-skin contact and breastfeeding help with bonding no matter how the baby is born. Final thoughts and call to action. C-sections are life-saving and nothing to be ashamed of. Whether planned or unexpected, birth is birth. And the most important thing is a healthy mom and baby. If you found this video helpful, hit that like button, comment below with your thoughts or questions, and don't forget to subscribe for more informative content. See you in the next video. Outro music plays, subscribe animation appears on screen.